Hi, my name's Dr. Iram Sattar. I'm a GP. Let's talk about cervical screening. Did you know cervical screening helps prevent cancer? But many women, especially in South Asian communities, aren't sure what it involves. All women aged between the age of 25 and 64 are invited for cervical screening every 5 years to check the health of their cervix. Let's hear some of the questions many women have about cervical screening.
Hello, doctor.
Hi there.
Nice to meet you.
Nice to meet you too. How can I help?
Hi, doctor. I got this letter about cervical screening, but I wasn't sure what it meant. And when I saw it, I felt a bit nervous and didn't know what to expect.
There's nothing to worry about. The cervical screening test is a short test to check the health of the cervix. The cervix is the opening of the womb, and cervical screening helps prevent cervical cancer. It checks for a virus called HPV, and it looks for cervical cell changes.
I have received this letter before, but I've always put it aside. Life gets busy and I don't think about myself. Is it really that important?
Cervical cancer is serious, but the good news is it can be treated successfully if it's found early, and screening helps us spot changes before cancer even develops. Fewer South Asian women attend screening, which increases their risk, so it's really important that you go for screening when you're asked to.
So what does the screening involve? What should I expect? Does it hurt?
Screening is actually quite quick. We use a small instrument called a speculum. You can see what it looks like here. This is placed gently into the vagina, and then through that we take some samples from the cervix using this soft brush, as you can see.
Yeah.
Some women might find it uncomfortable, but it shouldn't be painful. We know that the test can feel worrying. If it helps, you can choose to see a female clinician, ask for an interpreter, or take extra time if you need it. What's important is that you feel comfortable, safe, and supported.
Is cervical screening only for married women, or should unmarried women go too?
Cervical screening is recommended for all women and people with a cervix from the age of 25, regardless of whether you're married or not. The risk of cervical cancer is very low for someone who has never been sexually active, but it is still possible to get cervical cancer even if you have never had sex or have only had one sexual partner. Both men and women can carry and pass on the virus that causes cervical cancer, so the best way to reduce your risk is to attend a regular cervical screening when invited.
That makes sense. When will I get my results, and what happens if something is wrong?
Most results are normal, and you'll usually get these by post or in the NHS app. If your results show any changes, it doesn't mean you have cancer. It means we may need to repeat the test or do some further checks. The important thing is that finding changes early means they can be monitored or treated before they ever have the chance to turn into cervical cancer.
Thank you, doctor. This has really helped me understand and clear a lot of my doubts. I will be booking my screening today.
If you have any questions, you can talk to your nurse, GP, friends, or family. Going for screening is a really important way to look after your health.